have told you, we do a research and we have some observations, some findings, we analyze them and we draw an inference. So there are some aspects, some things which change the results, which distort the results. And so that means the finally results that we find and we observe and we give inference is not the reality. It is deviating from the reality that is actually in place. So there are these two broad groups. One is known as chance and the other as bias. And these are the different names for that. Chance is also known as random error, sampling error, non-differential error. And bias is also known as systematic error, non-random error, non-sampling error and differential error. So these are the two things. So what are these? Little bit about that. So what is chance? This is deviation of results and inferences, and it is different from the truth that exists. And this happens approximately in equal amounts in all groups. And this happens due to random factors and occurs only as a result of chance. So the word chance, you understand what it is. This is just happening. We have no control over this. By chance it happens. And why does this commonly happen? Because we are doing it on a sample. We are not doing it on the entire population. I have told you, if this is the entire population, we have an option that we take each and every subject from this entire population. But it is not feasible because the entire population is very big. That is the target or reference population. And so since we cannot cover that, we have time constraint, we have logistic constraint, we have financial constraint. So what do? We take a sample out of it. Means we take some people, not all. And we do the study on these people, and whatever finding we have, we project it on the entire reference population. So because we have selected this sample, this type of error happens, chance. So we have selected this sample. We could have selected this sample also. We could have selected this sample also, this sample also. So different samples, we could have taken any number of samples from one whole population. So now there is no guarantee that all these samples will be exactly identical. So they will vary. So the findings from sample 1 will have this, sample 2 we will have some other findings, sample 3 we will have. Suppose we are taking mean weight of a population. So we take multiple, suppose the truth, reality mean weight is 50 kg. Now we take different samples. So sample 1 shows say 52 kg, sample 2 shows 48 kg, sample 3 shows 45 kg. So they may differ. Again, sample 4 may show 52 kg. So these will be different, maybe different in different samples, and that happens just by chance. We have no control over it. We have not done anything incorrectly. Our process was absolutely fine, it was correct. But in spite of that, because we are taking different samples, little bit of error does happen. This is what chance is. So that is also known as sampling error, as I have told you. So the features are, it is caused by unknown and unpredictable changes. We cannot predict how it will happen because we are just picking up randomly. And what findings will come from that, we are not aware about that. And it often follows Gaussian or normal distribution. That means this is the normal distribution curve. Again, I am not going into detail. I will tell you about this in the session on statistics. Then you will understand. Just remember this, that for chance, it happens like this. It follows a normal distribution curve. And this affects reliability. I have told you about reliability. Reliability is also known as repeatability. That means the multiple number of times we repeat, they should ideally give the same result. So had we taken 4 times and we had got say 50 every time, that means it is perfectly reliable or repeatable, but which in reality does not happen. So it varies from one sample to another. So the more the difference, the more the chance sampling error is, the reliability is less. So that is what. So the sampling, so that depends on the sample size. Again, this I will explain to you at the time of sampling session. So basically chance affects the reliability. So because we are taking multiple samples, so difference comes, so the repeatability is compromised to a certain extent. The second part is bias. So what is bias? Here also the findings may be distorted, but this distortion may be in one direction. In the other one I had told you, it remains similar in all, and here it is in one direction and it may affect one group more than the other. And this is due to non-random factors. So this is also known as systematic error, I have told you. So why systematic error? Because this happens due to some fault in the system or in the way that we have conducted the study. So this is unpredictable, and this may be intentional or unintentional. Unintentional is we are not aware of it, it just happens. There was some way it was done, performed wrongly, incorrectly, and that is why this error happened, bias happened. It may be intentional. Like I have told you in the previous one, we should take random sampling or probability sampling. Again, I'll explain all that to you. So there this chance is minimized and here bias is minimized rather. So here what happens is, suppose intentionally, suppose we take a purposive sampling. That means we decide that okay, we will include these people or we will include people from this area. That is because of our convenience or feasibility, whatever the reason may be. But we have purposefully selected. That is known as non-probability sampling. Means we didn't go for random one. We had a purpose. Purposefully we selected a sample. So that means it is intentional. And that sample we selected may not be representative of the entire population. So that is intentionally we have committed a mistake in the system or the way in which we have performed the study. So that is bias. And this affects internal validity. Now I have told you what validity is. That means how accurately it measures what it is supposed to measure. Like in the context of screening, I have told you if it is diseased, how accurately it can identify that it is diseased. This person is diseased. So basically validity is how correctly it gives the truth, gives the true result, correct result, what is existing in reality, how accurately we can reflect that in our study sample also.